General protocols for cancer care during COVID pandemic for the state of Kerala. Initial evaluation guidelines. Nearest oncological facility should be utilized to the maximum extent possible to avoid long-distance travel by the patients. Basic evaluation and workup of suspected cancer cases may be done at the district level, and diagnosed cases may be referred to the nearest cancer care facility. Only those cases that require specialized care need to be sent to referral cancer centers. All cancer care facilities will put in place protocols for screening and triaging patients and bystanders. Social distancing and hand-washing protocols may be strictly adhered to. For all patients who are not on active treatment, follow-up visits may be postponed till COVID crisis is over. Patients on palliative treatment may be advised to continue treatment at nearest palliative care facility available. All major cancer centers may initiate facilities for virtual OPD teleconferencing networking with state-level and district-level cancer care facilities. Facilities to be made at peripheral level. Cancer drugs may be made available at all district or taluk-level cancer care facilities. All palliative drugs, morphine, to be made available at peripheral centers. COVID-positive cases. All cancer care facilities to have a tie-up with the nearest COVID care center and to have a plan of action to deal with COVID-positive or suspected patients plan. Protocols for elective cancer surgeries. Selection of elective surgical patients. Preference may be given for oncological surgeries for early-stage primaries where options of neoadjuvant treatment are limited, of doubtful benefit only. Patients with borderline operable cancers who are likely to progress if surgery is deferred also need to be prioritized. To give preference for patients with minimal comorbidity and expected ICU stay of less than 48 hours, so that confusing clinical situations can be avoided in post-operative period. High-risk surgeries like pancreatic duodenectomies, esophagectomies, lung resection, extensive cytoreductive procedures, retroperitoneal resections etc. may be taken up for surgery after discussion in a multidisciplinary tumor board. Frozen section facilities might be limited, hence to plan surgeries in such a way so as to minimize frozen section studies. All patients may preferably undergo RT-PCR assay prior to surgery. Chemotherapy protocol. Chemotherapy may be continued for patients on active treatment/curative treatment, and the decision may be made by a multidisciplinary team. Appropriate chemotherapy may be given to those patients who attend the OP/IP by the treating physician. The age of the patient and comorbidities may be taken into account when prescribing the chemotherapy regimen. Patients may be informed about the risk of chemotherapy during this outbreak, and consent has to be taken. As far as possible, patients may be advised to take chemotherapy from the nearest medical college or district hospitals or GH or local hospital. The district administration may make necessary arrangements in discussion with nearest oncology center. Patients on oral medication can be prescribed medications for 3 months with monitoring of blood counts at local hospital. All intensive chemotherapy which can cause prolonged myelosuppression and would require prolonged hospitalization, blood product transfusions and other supportive treatments may be avoided and substituted by bridging chemotherapy as appropriate till the present crisis is over. Exceptions may be given for newly diagnosed acute leukemias or high-grade tumors in view of the urgency. All bone marrow transplantations may be put on hold till crisis is over. Radiotherapy, principles to be followed during COVID pandemic. All planning may be done as per schedule. Radiotherapy treatments including brachytherapy may continue as per schedule. Concurrent chemotherapy may be given on a case-to-case basis. Oral agents may be considered as an alternative on a case-by-case basis. Hypofractionated regimes may be considered for radical intent treatment as well so as to reduce the treatment time. Hypofractionated schedules may be considered on a case-by-case basis for patients requiring urgent radiotherapy, e.g., airway obstruction in elderly/debilitated patients, CA rectum with obstruction, ureteric obstruction. Single or short-course radiotherapy may be delivered for oncologic emergencies such as spinal cord compression, SVCO, massive bleeding. A presentation from Government of Kerala, Department of Health Services. Thank you.